Most folks over 60 believe a frustrating lie. They think that waking up 3 times a night to run to the bathroom or scouting out every rest stop on a road trip is just a tax you have to pay for getting older. They assume it is just an enlarged prostate for the men or a weak bladder for the women, and that nothing can be done except buying thicker pads or staying close to home. But that is flat out wrong. The real reason you are peeing so often after 60 is not just an old bladder. It is a hidden shift in how your entire body manages fluids, hormones, and inflammation as you age, things your standard 7-minute Medicare visit completely overlooks. I am Dr. Carl. I have spent the last 16 years practicing as a urologist, helping thousands of seniors reclaim their sleep and their freedom. Today, we are going to break down the real, underlying reasons for that constant urge, counting down the 7 hidden bladder triggers that your doctor probably has not mentioned. We will look at everything from the surprising way your evening feet swelling turns into midnight bathroom trips, to a common supermarket habit that mimics a bladder infection. Make sure you pay close attention to number 5 because it is a very common prescription drug interaction that almost no one connects to their bladder health. Before we dive into the first trigger, I want to ask you a quick question. How many times are you currently getting out of bed each night to use the restroom? Drop your number in the comments below. I read every single comment, and your answers directly shape the medical topics I cover in these videos next. Let us start with the first hidden culprit, which I call the afternoon fluid trap. Many seniors notice that their ankles and feet look a little puffy by the time they sit down for dinner. This is especially true if you spent the morning playing 18 holes of golf or walking around the neighborhood. What is happening inside your body is a simple matter of gravity and circulation. As we get older, our veins do not pump blood back up to the heart quite as efficiently as they used to. Fluid pools in your lower legs during the day. Then, the moment you lie down in bed to sleep, gravity is no longer fighting you. All that trapped fluid rushes back into your bloodstream. Your kidneys see this sudden surge of fluid and go into overdrive, producing a massive amount of urine right when you are trying to sleep. A review by the American Urological Association shows that this nighttime fluid shift is actually the leading cause of waking up to pee, rather than an issue with the bladder itself. To fix this week, try elevating your legs above your heart for just 30 minutes in the late afternoon, around 4 or 5 o'clock. Put your feet up on a stack of pillows while you read the paper or watch the news. This coaxes that fluid back into your circulation early, allowing you to pee it out before your head hits the pillow. Of course, if you have a history of heart or kidney issues, check in with your doctor before changing your daily routine. The second reason you are running to the bathroom is something I see at the pharmacy counter every single day, and that is hidden bladder irritants masquerading as healthy choices. Many seniors cut back on sodas and juices to manage their blood sugar, switching instead to sparkling waters, diet drinks, or even certain herbal teas. What they do not realize is that artificial sweeteners, carbonation, and even the citrus flavorings used in these drinks act like sandpaper on the sensitive lining of an aging bladder. As we cross into our 60s and 70s, the protective barrier inside the bladder naturally thins out. When you pour highly acidic or chemically sweetened liquids over that delicate lining, it triggers a sudden, spastic muscle contraction. Your brain receives an emergency signal saying the bladder is full, even if it only contains a few thimblefuls of urine. Research published in the Journal of Urology has linked artificial sweeteners directly to increased urgency and frequency in older adults. If this sounds like you, your action step for the next 7 days is to do a simple elimination test. Swap out the sparkling waters and diet beverages for plain, room temperature water for just 1 week. You might be shocked at how quickly that sudden, frantic urge subsides when you stop irritating the tissue. Our third hidden trigger involves the silent clock inside your brain, specifically the age-related decline of a vital hormone called antidiuretic hormone. When we are younger, our brains naturally produce more of this hormone at night. It signals the kidneys to slow down urine production, so we can get 8 hours of uninterrupted rest. However, as we get older, our bodies produce significantly less of this hormone during the night. The result is that your kidneys keep working at daytime speed all night long. Many doctors are seeing this hormonal shift as a primary driver for nocturnal polyuria, which is just the medical term for overproducing urine at night. While you cannot easily change your hormone levels on your own, you can change how you manage your hydration rhythm. Try implementation of the reverse hydration strategy this week. Drink the vast majority of your fluids between waking up and 3 in the afternoon. After 3 o'clock, switch to small sips only when you are thirsty. This gives your kidneys plenty of time to process the day's water before your nighttime hormone levels drop. The fourth culprit is something that surprises many of my patients, and that is chronic, low-grade constipation. You might wonder what your bowels have to do with your bladder, but they are actually crowded together in the exact same tight space inside your pelvis. When your colon is full or sluggish, it physically presses right against your bladder. This constant pressure does two things. First, it reduces the actual physical amount of urine your bladder can hold. Second, it irritates the nearby nerves, making your bladder feel full when it is barely functional. Mayo Clinic reviews suggest that managing bowel regularity is one of the most underutilized tools in treating overactive bladder symptoms in seniors. If you are not having a smooth daily bowel movement, try adding a handful of ground flax seeds to your morning oatmeal or yogurt this week, and make sure you are moving your body daily. A gentle walk after dinner can work wonders for both your digestion and your bladder capacity. Quick pause here. If this information is helping you connect the dots about your own health, please tap that like button. It truly helps this video reach more seniors who are quietly struggling with these exact same issues. And let me know down in the comments, did you know that constipation could affect your bladder? I love seeing your insights. Now, let us move on to number 5, which is the big one I warned you about, the prescription drug snowball effect. Many financially comfortable retirees are proactive about their health, taking excellent medications prescribed by top specialists for blood pressure, joint pain, or mild swelling. But these medications often fight each other in your pelvis. The most common offenders are diuretics, often called water pills, prescribed for blood pressure. If you take your water pill too late in the day, like with your evening meal, it will hit its peak effectiveness right around midnight, guaranteeing multiple trips to the bathroom. Furthermore, certain blood pressure medications called calcium channel blockers can relax the bladder muscles too much, preventing it from emptying completely, which leaves you feeling like you need to go again just 20 minutes later. Some studies suggest that up to 20% of bladder frequency in seniors is actually a side effect of medication timing or interactions. Now, hear me clearly on this. Never stop or alter your prescription medications on your own. Instead, take your full list of pills to your next doctor's visit and ask a simple question. Could the timing or type of my blood pressure medication be aggravating my bladder at night? Often, a simple shift from an evening dose to a morning dose can change your life. The sixth trigger is the loss of pelvic floor coordination, which is very different from just having weak muscles. We have all been told to do Kegel exercises, but for many seniors, the problem is not that the pelvic floor is weak, but rather that it is constantly tense and tight. When you are stressed about finding a bathroom, or if you have been rushing to the toilet for years, those pelvic muscles can lock up into a permanent state of spasm. A tight muscle is a weak, dysfunctional muscle. When your pelvic floor cannot relax, you cannot empty your bladder completely when you sit down. You leave an ounce or two behind every single time, meaning your bladder refills much faster, sending you right back to the commode. Research from the American Urological Association highlights pelvic floor physical therapy as a highly effective, non-drug treatment for senior bladder issues. This week, practice breathing deeply into your belly while sitting on the toilet. Do not push or rush. Let your lower abdomen expand completely, which naturally signals those pelvic muscles to drop and open, allowing a full, satisfying release. Our seventh and final hidden trigger is early-stage metabolic resistance. Even if your doctor has told you that your blood sugar is perfectly fine for your age, subtle insulin resistance can cause frequent urination. When your body has to work harder to process carbohydrates, glucose levels in the blood rise slightly after meals. Your kidneys try to flush out that extra sugar by pulling water from your tissues, creating more urine. Many doctors are seeing that even mild spikes in blood sugar after a heavy, carbohydrate-rich dinner can trigger a night of broken sleep and frequent bathroom visits. Try a simple experiment this week. Keep your evening meal focused on lean proteins and green vegetables, saving the bread, pasta, or sweet desserts for lunchtime. You might find that stabilizing your evening blood sugar keeps your bladder quiet all night long. To show you how this all comes together, let me tell you about a patient of mine named Robert. Robert is a 72-year-old retired corporate executive who spends his winters in a beautiful community in Naples, Florida. He came into my office thoroughly exhausted, admitting he was getting up 4 times a night and was terrified of the long drives to see his grandkids because he had to stop at every single exit. He assumed his prostate was failing, but his exams were actually quite stable. When we looked closer at his lifestyle, we found 3 things. He was drinking sparkling water all evening, taking his blood pressure medication at dinner, and his ankles were swollen by 5 p.m. We made 3 simple adjustments. We moved his medication to the morning, had him prop his legs up while reading the afternoon paper, and swapped the evening carbonated drinks for plain water. Within just 3 weeks, Robert went from waking up 4 times a night to just once, and he recently completed a 4-hour road trip without a single emergency stop. His bladder was fine. We just had to fix the hidden triggers. So, let us look at tonight's plan to get you sleeping through the night again. First, elevate your legs for 30 minutes in the late afternoon to clear out trapped fluid early. Second, stop all carbonated and artificially sweetened drinks for 7 days. Third, shift the bulk of your water intake to the morning and early afternoon hours. Fourth, add a little extra fiber to your morning routine to keep your bowels moving freely. And fifth, schedule a chat with your doctor to review the timing of your daily medications. Managing your bladder as you age is not about accepting a lower quality of life. It is about understanding how your changing body processes fluids. In our next video, we are going to expose a common item sitting right in your pantry that mimics the exact symptoms of a urinary tract infection, causing severe bladder burning and urgency without any actual bacteria present. You will want to check your cupboards the moment you watch it. I am Dr. Carl. Stay well, and I will see you there.